In my 20s, I took a simple approach to skincare. A no-frills cleanser and moisturizer was all I really needed. Fast forward to last year, on my 37th birthday, my 5-year-old son looked at me inquisitively and asked, "Mom, what's that big crack on your face?" pointing to my laugh line. On my birthday of all days. Let's just say that I decided then and there it was time to get serious about skincare. I'm Sarah James. I love my family. Blogging, great design, sunshine, and finding the perfect shade of lipstick. Welcome to the Sarah James Show. Hi, thanks for joining me. Today we're going to be talking skincare for those of us in our 30s. I'm so happy to be joined by dermatologist Dr. Strachan and a mom of a 6-year-old girl.
That's
Welcome,
right.
Dr. Strachan.
Thanks for having me, Sarah.
So I have got lots of questions for you today. The first one being, my son recently mentioned me having cracks on my face, and it made me realize I need to start really worrying about age-appropriate skincare. So what are some of the things that are going to help treat and prevent these so-called cracks?
Okay, well, when we hit our 30s, there are two things that are coming into play. We have our genetic aging and then our habits. And one of the things that start to show up are volume loss, sun damage if we weren't protecting our skin in our 20s, that sort of thing, bony changes, and these all make us tend to look older.
Okay, so that's kind of the hyperpigmentation that can be happening around the eyes. That's usually from sun damage.
That can be genetic or sun damage. You can start to get fine lines. You can start to get discoloration, freckles, or textural changes. And if you're very fit, sometimes the downside on your face is that you start to look sunken. You lose volume in your face and you start to get folds around your mouth.
Okay, so the folds around the mouth, that's coming from that. But really, I've noticed with me, it's being out in the sun when I was in my 20s and my teens. So that was one of the questions I heard all the time from my readers was about sunscreen. When should you put it on? How often should you reapply it? What SPF should you be using? Something like that.
Sunscreen is the most important thing you can do for skin health and beauty, and you should be using it every single day. The American Academy of Dermatology recommends an SPF of 30 or higher with UVA protection as well.
Okay, so the UVA and UVB, and you should be applying it in the morning and just midday. If you're in an office though, I mean, is it just fine to put it on in the morning and then you're good? Or
if you're just, once a day, you're traveling to work, that's fine to apply the sunscreen once a day. If you're out all day, you should be reapplying it every 2 hours, or if you're sweating or getting in water, then you should reapply it.
Okay, and I live in Southern California, so I always have sunscreen in my bag, along with a whole slew of other goodies. Let's take a look at what's in my bag. Here's some of the other things I carry for skincare on the go. Sunscreen, obviously. Being a mom, I wash my hands all of the time, so I always have hand lotion with me. A moisturizer for an all-over body moisturizer, especially if I'm traveling. Lip balm is pertinent, and I love the ones that have SPF in them. And of course, you need sunglasses and a hat for shade. Okay, so here's another very popular question. What should my nighttime routine consist of?
Generally speaking, you want to use a gentle cleanser and a moisturizer, and you might want to have something that has an ingredient such as a retinoid, glycolic acid, or salicylic acid for exfoliation.
Okay, I need to know about this because I actually was just prescribed a retinoid by my dermatologist. But I have it, it's sitting at my house. I haven't used it yet. I'm just kind of looking at the bottle right now. I'm moving very slowly, but I'd love to hear your thoughts on how this helps to prevent and treat any aging in the face.
Well, retinoids are great because they both treat and prevent aging, particularly sun aging, and it actually stimulates collagen production in the skin, which you're losing in your 30s.
Which is amazing.
Yes.
Is there really anything else that does that?
Salicylic acid and glycolic acid also do that. And another perk is that they prevent acne.
Oh, well, that's perfect. Okay, I'm going to use it this week, I promise. And so another question I have for you is something I'm dealing with this week, actually, is puffy eyes. When I travel, I notice that sometimes I wake up, I feel like my eyes are just swollen shut. What are some ways you can help treat puffy eyes?
Well, first you want to determine why your eyes are puffy. Do you have allergies, a thyroid problem, are you retaining water? You want to avoid salts, and if you don't identify any of those reasons, something like a cold compress might help.
Okay, so I've always heard of the whole cucumber thing. Does that really help?
I think it's for the cooling effect.
The cooling effect.
Yes.
So you just want to place something on it that's cool. It will help reduce the swelling.
Exactly.
Okay, my very last question for you is about facials. A lot of my friends get facials all the time. What's the benefit of getting a facial?
I like to think of a facial like a massage. I mean, you can do it for pampering or you can do it for a medical reason. So some patients get facials for acne, or you can have ingredients in it that rejuvenate the skin, or you may just do it to reduce stress and get a massage.
So it actually does rejuvenate. Is it the stimulation of the skin?
It depends on what someone uses in the facial. Just like some massages have hot rocks and some stretch you and some press on certain areas. If they use ingredients that exfoliate, that can rejuvenate the skin. Sometimes they hydrate the skin. There are different reasons.
Would you say there's a certain amount of time you should go for? I mean, your facial's like just a luxury, or is it good to go every couple of months?
I think it depends on why you're doing them, and I don't think there's anything wrong with going monthly for a facial, even if it's for pampering and it helps you relax and feel better. And if someone has a problem such as acne, which is a reason I send people for facials sometimes, until they get the results they want.
Okay, well, if you're telling me to go every month, I mean, I have to go every month. You're a doctor, after all. Well, thank you so much for being here. You had so much information. It was very, very helpful.
Well, thank you for having me.
And thank you for watching. Now, I want to know the secrets of your skincare routine. Let me know in the comments, and be sure to subscribe to CafeMom Studios on YouTube so you don't miss a single episode. See y'all next time.